So before we run into the prescriptions, I'll give you a little bit of quick background. What do you need to know for suspensions at a minimum here's the deal. It's a liquid preparation, right? So a suspension is a liquid. You're going to take some drug and you're going to put it into a liquid. Will it disappear? Will it dissolve? Will it disperse? What happens? What is the difference between a solution and a suspension? A solution is when you put the drug into the liquid and it disappears because it solubilizes. The advantage to that is when a drug becomes soluble, it disperses everywhere within the liquid evenly and stays there, okay? That means the concentration of a solution doesn't change from day to day to day. You don't need to do anything with it. You don't need to shake it. It's just the drug is dissolved, so it's evenly dispersed in that liquid and stays that way. The problem with a suspension is the fact that you've got a drug, a solid, that you put into a liquid form and you shook it up, but it didn't dissolve. It doesn't solubilize. It stays as a physical particle, okay? Now, it can be dispersed evenly to begin with, but because it is still a physical particle, what happens over time? What does gravity do to our physical drug? It sucks it down to the bottom of the container. So again, suspensions will settle out. So that's a problem. The other thing is that solids like powders tend to clump together. They don't like to disperse. They rather hold on to themselves and make a powder clump than they do want to disperse within the liquid. So we have to work hard to make sure that powder gets evenly dispersed within the liquid and stays dispersed at least long enough to be able to prepare a dose. So when you shake a suspension, it doesn't have to stay suspended for a month or even a day or an hour, but at least 5 or so minutes so that it can, once you shake it, it's resuspended, it is evenly dispersed, and you can pour a dose and administer the dose. So long enough to be able to be homogeneously dispersed so that the dose that you measure when you measure a certain volume is correct. So in the end, suspensions are liquid preparations of solid particles that are not solubilized, but dispersed, okay? So dispersed and not soluble. So hopefully it's not a solution, it's a suspension. Well, you're gonna make a suspension. There are 4 important things to really know to get a good suspension and the way we're gonna grade your product. What are we gonna look for? First of all, to help minimize clumps, there's 2 important things. You really have to make sure the powder is ground to as fine a state as possible. So that's your whole point about trituration. So today you're going to be using tablets and capsules as your source of active ingredient. Those tablets especially, you need to grind them really good. You'll see they don't just instantly fall apart, you got to grind them. So make that powder as fine as possible. That will facilitate its dispersion within the liquid. So fine powder size using trituration. Then the most important step, and hopefully you watched the preparation video, is this. How do you take a dry powder and make it into a liquid? Well, you have to transform it. You have to transition it from dry to wet. And the term that we call to do that is called wetting the powder. But, and I don't know if anyone gets this analogy anymore, but I remember growing up, milk. I didn't milk, I wanted chocolate milk. So all my parents would give me a thing of milk and then the powder. And I'd scoop the powder, chocolate milk, and put it in there and try to mix it up. And it would all clump together and float on top. And I remember trying to break up those powder clumps to make it chocolatey. What is he talking about? Well, that's the point, is today, when you pour your liquid onto your drug powder, it will form a clump. And if you liquefy it too quickly, those clumps float around and you cannot stab it to death with your pestle. So how are you going to make sure you don't get the clumps to form to begin with? Wetting the powder means taking the thicker or more viscous liquid, in this case, the suspending agent that you'll be using, and adding it slowly in very small amounts, and then pushing that powder into the liquid. Because at that point, there's not enough liquid, you can just shove that powder and force it into the liquid. Add a little more liquid, force that powder into the liquid. You're basically pushing the liquid and using it to push the air off the powder so that you force the powder and the liquid to actually mix together, all right? Eventually, when you keep adding liquid, it goes from a clumpy powder to a pasty powder to a slurry to a liquid. So you will transition from a solid to a liquid, but if you go too fast and it becomes too much of a liquid volume, then as you push the powder around, it will stick to itself and just float around in your liquid, and you can't get it to separate. So remember, wetting, as we'll talk about, is key to really avoiding clumps, which is the hardest part to your suspension. Now, secondly, a suspension, as we said, you can't just use water because you would shake it up and the powder would then fall back to the bottom almost instantly. So how do we make it stay suspended in the liquid? let's increase the viscosity. In viscosity, think of it as the thickness, all right? So you're going to use a suspending agent. What is special about a suspending agent is that it increases the viscosity of the liquid. Now, we used to have to make our own suspending agents, things like methyl cellulose, if you watch the podcast, or other examples as well. And those would be super thick, but it doesn't need to be that thick. It doesn't have to be like honey that's just super thick and gooey, but you'll see it needs to be viscous enough so that it doesn't instantly settle. And again, we're going for 5 to 10 minutes of remaining in suspension long enough to be able to prepare a dose. So we want to slow the sedimentation rate by increasing the viscosity. And then lastly, getting back to my honey analogy, if you will, you don't want it so thick so that when it does finally settle and you then shake it again to use for the next time, that it cakes at the bottom, or that it's so thick that you can't get the drug to redisperse into the liquid. So we don't want them so thick like a milkshake that if you put powder in the bottom of a milkshake, there's no way you could shake it and get it to redisperse. So that's the term flocculated systems. The suspending agents you're going to use today, the Aura Plus, for example, is what we call a highly flocculated system, meaning while it increases viscosity, it doesn't do it so that it gets so thick that the powder can't redisperse. So again, the powder can easily redispersed in a flocculated system, which avoids the caking, where all of that drug powder just sits on the bottom of the bottle and can't be released. All right, I know you're bored, but those are important properties of your suspension. Okay, well, now this is important because today and on the exam, there are 2 ways to formulate a suspension. You can formulate and compound them. So both the calculations and the procedure are different depending on whether you use the excess method or the exact method. Okay, and you are responsible for both. So Judy and I in a minute will do our dry lab prescription. We're going to use the excess method. It's the lazy man's method because I am a lazy man. And so here's the deal. You'll see here in a minute, the prescription, the way we're going to formulate it is a little more complicated in the calculations. The calculations aren't as straightforward, but when you can figure it out, then the preparation is easy because here's the deal. Remember how the capsules, before you'd have to open some capsules and weigh out the proportion and set up the proportion to calculate how much powder you need because you don't need a full capsule? That's a pain in the butt. We're going to calculate so that we use whole capsules, so I don't have to do all that work. Okay, it makes it much easier to actually prepare the suspension. Okay, however, the exact method is the method you're going to do, and in that method, you will not calculate for any excess drug. You're going to do exactly what the doctor prescribes. So the calculations are more straightforward. But because of that, you can't lose any drug. So your procedure is different. You have to rinse your mortar several times to make sure you do get all the drug out of the mortar because you don't have any excess. So my take-home message for now is just realize there are 2 different methods. You're responsible for both, and know that both the calculations and the procedure are different for the 2 different methods. So keep them clear. That's your assignment today as we go through this. Make sure you understand both of them. Okay? Let's start with the dry lab prescription, all right? So let's read and interpret the prescription here. Your first prescription should be for Tim Mott for the drug bethanechol, okay, which is a cholinergic mimetic. It kind of mimics the parasympathetic nervous system, so it stimulates those muscarinic receptors. So anyways, we got bethanechol, the drug. What concentration does the doctor want? Be careful with suspensions. The prescription calls for 7.5 milligrams of the drug per what? In this case, 5 milliliters. The trick with suspensions is the doctor can prescribe them using different units for concentration. It can be in milligrams maybe per milliliter, or in this case, milligrams per 5 milliliters. What if I said it was milligrams per teaspoonful? You got to be careful. The 2 common volumes that you need to be comfortable with is a teaspoonful is the same as 5 milliliters. A tablespoonful is 15 milliliters. All right. Those can be used to express concentration. So be very careful when you're interpreting the prescription that you don't mess up the units. In this case, it's 7.5 milligrams per 5 milliliters. Okay. We want a suspension, and the doctor wants you to dispense 80 milliliters. Okay? Can you make more than 80 milliliters? Sure, but you can only dispense 80 milliliters. So keep that in mind. That's what we're going to want to dispense. All right. Lastly, on the additional information, the big thing that will be today and on the exam as well, I will specify which method you need to use, because I want you to show me both of them at some point during the test. So it's not just a your choice thing. So we will only give you credit for and only grade as if the correct way to make it would have been for the method we specify. So in this method, we're going to do the excess method. You'll see what I mean here in a minute. All right, so we're going to do the excess method. Our source of active ingredient in this method for this prescription will be bothanicol, but we don't have it as a pure powder. That's going to make it more difficult. We have 50 milligram capsules. All right, so keep that in mind. So as you can see here, as before we do our calculations, I've got 50 milligram bothanicol capsules as my source of active ingredient. But what am I going to use as my suspending agent? How am I going to formulate this drug powder into a suspension? Well, hopefully from the video you realized you need a suspending agent. There are some drugs that are, I meant drugs, there are some preparations, liquid preparations that are suspending agents. Look between you and the person sitting across from you. I have set bottles out at each of the stations for you to share between you and the person across from you. There are 2 bottles there. One of those bottles should say Aura Plus. Aura Plus is made by Paddock. It's a commercially available suspending agent. It works really well for what we want to do. Can you make a suspension using just Aura Plus? No, because as you pour it out today, you'll see Aura Plus is kind of white, it's cloudy, it's viscous, and it tastes kind of nasty. It tastes like chalk. So while it increases the viscosity and allows it to be a highly flocculated system for resuspension, it don't taste no good. So how do you use these commercial products? Well, you use them 1-to-1. That is 50% suspending agent with 50% flavoring vehicle. Okay, so since Aura Plus is a suspending agent, you'll notice the other bottle I've provided you is called Aura Sweet. Aura Sweet is just that. It's a sweet flavoring vehicle. Okay, it's not cherry syrup, my favorite, by the way. There's Serpalta, which is kind of a grape flavored syrup. Aura Sweet is also another syrup. It's more like simple syrup in the sense that it's fruity and sweet tasting, but doesn't impart a really strong flavor. Regardless, any one of those flavoring agents can be used in equal volumes with a suspending agent. Okay, that's what you're doing. Just make sure you're ready for that. I am lazier than you are. So here's the deal. I know there's a third product out there called Aura Blend, made by the same company, Paddock. So what do you think is in Aura Blend? It's a pre-blended version that contains 50% by volume suspending agent and 50% flavoring vehicle in the form of Aura Sweet. So it's basically Aura Plus and Aura Sweet already pre-mixed at a 1-to-1 ratio. So guess what? I only need to use 1 bottle. So I'm going to use Aura Blend as my liquid since it's both flavoring and suspending, and my drug bothanicol, 50 milligrams. All right. So let's do this. Now I'll illustrate what I mean by the excess method here in a minute. So let's start with this. You ready for the calculations? Get your calculator out. Don't depend on me, man. I mess up. So get ready to do this. Let's start with this. First question to ask is, how much bothanicol? If I fill the prescription the way the doctor has written for it, how much drug do I need? How much bothanicol would I need? Okay, so let's start with that. So set that up, see what you think. What would you do? Well, if it's basically from what the doctor prescribed, let's start with what the doctor prescribed, which was, where's my red pen in? We want to dispense 80 milliliters, right? So hopefully y'all can see my numbers there. So Judy, come get me if the numbers don't show up again. 80 milliliters, that's the volume to dispense. Times, what's the concentration? Well, I want 7.5 milligrams per what? This is where you got to be careful, per 5 milliliters. So do that math real quick. And when you do that, you'll see milliliters cancel, and that would be the total amount of drug I would need to prepare 80 milliliters at a concentration of 7.5 milligrams per 5 mLs. So what do you get when you do that? You get 120 milligrams. Easy breezy. That's how much. And guess what? If we had drug powder, all we would need to do is weigh out 120 milligrams, right? That would be a piece of cake. Unfortunately, we do not have pure drug powder. We have 50 milligram capsules. So let me ask you, how many capsules would we need to provide 120 milligrams? Well, let's take that and divide it. Oh, just so you know, that's my answer for that. But let's divide that by 50 milligrams per capsule. Milligrams cancel. And what do you get? What's 120 divided by 50? Okay. So I think I get 2.4 capsules. Okay. Well, I can't measure 2.4 capsules, right? I'd have to round up to 3 capsules, but I don't need 3 capsules worth of powder. So I'd have to set up a proportion and figure out how much powder out of those 3 capsules provides me only 120 milligrams. You know what that is? That's the exact method. That's what you're going to do, but I'm lazier than you. I don't want to do that. That takes a lot of work, but I'm kind of good with math. So here's the deal with the excess method. You know that 2.4 capsules, that's not going to work. I can make more and only dispense 80 milliliters. Remember, I have to dispense 80 milliliters, but I can compound whatever I want. Could I compound 50? Sure, but that's not even enough to dispense. So it can't be less than 80. I could compound more than 80 milliliters, any amount more than 80 milliliters, and still only dispense it. So what volume, why would I dispense or compound more? Let's compound a volume that requires an exact number of capsules. So instead of having to do this fractional thing, let's compound for a whole number of capsules. So let's not start with the volume, let's start with the capsules. I know I have to need more than 2.4 capsules, right? It could be 3 capsules, it could be 4, we could even go higher than that, but let's try 3 or 4. I don't know which one's gonna work better or not. So let's see, I like even numbers, so let's start with 4 capsules. Would you agree that 4 capsules is gonna have more than 120 milligrams? Well, let's figure that out. So I'm guessing here, but let's start this. Let's bear with me, let's work backwards. So if I chose to use 4 capsules so that I didn't have to split and set up that whole ratio, how much drug would that be? 4 capsules times 50 milligrams per capsule. What do you get when you do that? That means those would provide me 200 milligrams of drug. Okay, I can deal with that. Now, here's the deal though. I need to make sure that amount of drug is dispersed in a liquid volume that gives me the same concentration. So what volume do I need to disperse 200 milligrams in? So let's multiply that by my desired concentration. Well, we'll actually divide, but so let's do it in the form of 5 milliliters. For every 5 milliliters, we want 7.5 milligrams of bothanicol. And we do that so that milligrams cancel. So do that math real quick. Okay. So 200 milligrams times 5 milliliters divided by the 7.5 milligrams would tell me what volume I would have to disperse this 200 milligrams in to be able to get the same concentration. And I got 133 milliliters. Can I do that? Sure, that would work. Yeah, I'm lazy. Okay, and so here's the deal. You're going to see here in a minute, you're going to be measuring your liquids with these conicals, okay? And they're only marked in every 10 milliliter increments. So 133 is not a convenient number. That's going to be as much work to measure that volume as anything else. So that's not going to work for me. Let's try this. So let's try 3 capsules. I don't know. Let's try 3 capsules and see if that's a better number. Same calculation. Let's do 3 caps times that they're 50 milligrams, right, per capsule. What does that equal? 150 milligrams. How much volume would we need to disperse that in? So times for my 5 milliliters for 7.5 milligrams. What do you get for that? Milligrams will cancel. And 150 times 5 divided by 7.5. What do you get when you do that? I got 100 milliliters. Dude, I like that. I can measure that. That's easy breezy. So you know what I'm thinking of? I'm thinking, why don't we take 3 capsules, just all 3 capsules. I'm not weighing them. I'm just going to dump the powder out from 3 capsules because how much drug would that be? 3 capsules would contain 150 milligrams. And if I disperse that into a total final volume of 100 milliliters, bingo, I got a suspension that has 7.5 milligrams per 5 mLs. Now I got 100 mils of it, so I got to be careful. What can't I do? I can't dispense 100 mils, but I could pour out the 80 milliliters that the doctor wants and then discard the rest. So that seems to me an easy breezy way of formulating it. So let's go back to, not that far, fill out our compounding record. So we're going to use 3 caps for there, and we know actual will be 3 caps. We know with the or a blend, when you measure something by volume, you get exactly the volume you intend. So we'll do 100 milliliters there and 100 milliliters there. So there's the formulation right there in a nutshell. So we know what to do. And you're going to see here in a minute, because of the way I've done this and formulated it, it's going to be pretty simple. And again, I kind of skipped this part of it. So we realize there's the 3 capsules and the 100 milliliters of the or blend. Okay, so Judy's going to come in here now and we're going to do the compounding for you as she does that. All right, so, okay, hold on one second. What did I do? Participants, go away. Not you, the thing here. Okay, sorry about that. All right, so I'm babbling here. Before Judy goes to work here, let me just point out some couple of things on your compounding record. So look on the procedure, look on your procedure. A couple of key terms I want to point out, especially for you, is step 3. It says to wet the capsule powder. This is the key step to avoid clumps. So circle the word wet. It's extremely important when Judy does this. You watch her carefully. That is the key step to avoid the clumps, is wetting the powder. Now, in this excess method, Remember, step 4 is important. It says add the remaining amount of Aura blend to the mortar, meaning that the entire volume is added to the mortar. Everything is compounded in the mortar before step 5, which says to then transfer the volume to dispense. Okay, so I'm just trying to re-emphasize those are 3 key things for the access method to be aware of. Okay, so with that, Judy, tell us how to do it.
Okay, all right. This is probably the easiest dosage form that you can imagine in the semester. So I have 3 capsules here. I'm going to open them up. Do I need to know the weight of those capsule powders? No, I don't. So instead of open them in a weigh boat, I am actually going to open them directly into my model. So you guys have had enough experience with capsules. So I'm not going to do the slow motion here. So that's 1. Make sure it's all complete. And here comes the last one. Okay, that's the nice thing about using the access method, because I don't even need to measure the weight of the capsule powder. All right, the next step, we are going to measure, I believe it's a 100 ml. Is that right, Larry?
That would be correct, 100 milliliters.
How do I measure properly 100 ml of, in my case, oral blend? All right, so a couple of things. First of all, this is called a graduate conical. And then grab a graduate cylinder for you guys to compare. Okay, so hopefully you guys can tell the difference over here. The graduate cylinder is a skinny, uniform diameter container. The graduate conical, you can see that you start with skinny, tiny area on the bottom, and then the diameter gets bigger and bigger. All right, so we are using graduate conical one more time, not cylinder. The reason for that is because something like oral blend, or in your case, like oral plus, they are very viscous. So therefore, that you want to use a conical so that it gives you a wider area on the top. It will help you to drip as much as out from your container. All right, so now I'm ready to measure 100 ml. And this oral blend that contains, it's half of the oral plus, half the oral sweet. Therefore, it's very viscous. So make sure that you shake really well before you start.
Judy, let me just, before you do this.
Yeah, go ahead.
Why did you shake the Aura blend container?
That's a good question, because they could potentially can be separated out.
So just like your suspension needs to be shaken every time before the patient uses it, I just bring this up because it was so funny. Again, on Monday, the student had poured out without shaking it, and there was absolutely clear. Remember how I said a suspending agent should be cloudy? Your Aura Plus, our Aura blend, should be cloudy. It was clear because all of the cloudy stuff had settled to the bottom. So please remember to make sure the cap's on tightly, but shake your suspending agent before you measure it out yourself.
All right, so we shaked, and now we are going to measure. And pay attention to me. How do I bend my body? I am going to kneel down and transfer 100 ml into the conical. The reason I am really bending myself down is because I want my eyesight match with the surface of the liquid I'm putting in there. All right, because I don't want to have too much. If I measure it this way, my volume is not accurate enough. So you should do the same thing while in the lab. Now we are ready. Okay, so we have gathered our powder on the bottom of the model. What I want to do now is I want to use my pastel to make a one little dip. And now add a small amount of oral blend. And my goal is to make a very uniform paste. So let me do this. Okay, so that looks really good as a uniform paste that formed over there. Usually by the first edition, I try not to use my rubber spatula yet because I don't want to have too much drug stuck on the rubber spatula. Oops, where's the green? Okay. I'm testing with myself. All right, so here comes the second edition. Remember, it is geometric dilution. So I'm adding about the amount compared to what I have there inside the model already. And here comes my second edition. And let's titrate and mix. So my final product will become uniform. Okay, that looks so much better. Now this is about time I want to introduce my rubber spatula in here. So I can clean my pastel. And I want to also gather as much onto the bottom of the model as well. I want to have as less as possible on the wall of my model. Okay, and pay attention because your rubber spatula have jug on it, so you don't want to just lay on the bench. Place it on the top of a weighboat. All right, here comes the third edition. And remember, it's geometric. So by the third edition, then you're adding about twice amount compared to the second edition. Okay. All right. And again, I want to clean my pastel. Especially, I want to clean my rubber spatula because I got some drugs on it. I don't want to lose those drugs. Okay. All right. So here comes our fourth edition. And let's go ahead and mix one more time. Okay, one more time. I want to clean the pastel. And especially I want to clean my rubber spatula. So that to make sure I'm not losing active ingredients. And here comes the last addition. As you can see that it's very viscous, so there is definitely a certain amount stuck on the wall. And be patient with yourself. Okay, especially because I'm using exam method, I want my volume to be accurate. All right, and one more time, I want to clean my pastel, especially I want to clean my rubber spatula. I don't want to lose any jug. Okay, we are all set. All right, so here's the thing. Now we are ready to transfer. But how much are we going to transfer? Because we made 100 mil. So we're not transferring everything because it's access method. Based upon the script, we only need 80 mil. So we are transferring only 80 mil. So pay attention. I want to show you the proper way of holding model pencil together to be transferred. So your thumb will actually stabilize the model, and then your palm will hold on to stabilize the pastel, your palm will hold on to the model. So this is the proper way of transfer into the bottle, okay? However, if you have a teeny hand like I am, then you definitely want to remove away. But before I remove away, I want to actually mix one more time, okay? And I do not want this inside because I'm afraid of breaking it. All right, so if your hands are big enough, then you don't have to do this, but only if your hands are too small. So now we are ready to do transfer. Again, pay attention to how am I standing here. I'm really bending myself, so my eyesight is about matching the surface of my liquid. Okay, that looks perfect. All right, so we all set. And shake well before we dispense. Okay, all right.
Very good.
Thank you.
So we're going to proceed on and we're going to have to do the QA for this. So let's just kind of say right now, you know, what you would do for the QA is you would double check the volume. You want to make sure that in this case it reads 80 milliliters in it, and it does. And now we're going to have to describe this product. So give me a second here and we will try to describe what it looks like. Right. Okay, am I back at it? All right, I think we're back together. So QA, we got the right volume at 80 milliliters. Now, it's kind of a pain to describe this. We do expect a lot for you to, in terms of how to describe the suspension inside the bottle. Let's start with the color. So the first color, oh, let me do one thing real quick. All right, let's switch back to here. Okay. So color, what color? I know it's kind of hard to see. Did it seem kind of like an off-white, kind of tannish color? So let's call it off-white in color, okay? Was it clear or was it cloudy? Remember, it's got suspending agent, so it's cloudy. So we would call that opaque. So versus clear, it's opaque. So it's an off-white, opaque. Now smell it. It does have a smell. And you guys, when you do your suspension out there, it's not a strong smell, but I would argue you can smell something. So for this one though, we took a big whiff and we didn't smell anything. So we're going to call it odorless. Okay. So we have an off-white, opaque, odorless. And then lastly, we want to describe the consistency of the liquid as viscous. Remember, we wanted it to be viscous. That's why we had the suspending agent. So we have an off-white, opaque, odorless, viscous suspension with no visible clumps that is easily redispersed. Those are all the properties we kind of want in our suspension, so we want to describe that in our final product. So in the end, off-white, opaque, odorless, viscous suspension with no visible clumps and is easily redispersed. It's a mouthful, so be ready on the exam to be able to replicate that level of description of your final product. I realize that. Okay. Let's move on to the beyond use state. Oh, one thing real quick, quality control. So we described it there. There are some additional quality controls or QA things you can do. We used to in the past when we had more time, had you actually test the pH. Because when that drug's in solution, or as a suspension, I should say, you can check a good formulation and check to see what pH. And there are other quality assurance things you can do for suspensions. For us, though, we will limit it to the description of your final product. Okay. Beyond use date. This is confusing because it's changed. And I think some of the information on my slides might be a little bit out of date. So let me kind of clarify. USP 795 made changes last year that were supposed to start this year, but they held them back. So there's a little bit of confusion. But in the end, here's where they're leaning to. It used to be, as I described, that we had to make our own suspending agents, things like methylcellulose and so forth. And we didn't always add preservatives to them, okay? Because preservatives prevent bacterial growth. Without them, then the bacteria can grow and can increase this or reduce the stability of the drug, could lead to contamination. So we were really conservative about anything we were going to take orally. So if we compounded a suspension, we said you could only keep it for 14 days and also keep it in the refrigerator because that helps slow down bacterial contamination. What USP, the new revisions say this, most pharmacists don't make their own suspending agents anymore. In fact, they use commercial products. And these commercial products have preservatives in them. So even if you're going to mix Ora Plus with Ora Sweet, guess what? They both have preservatives in them. So when you mix them 1-to-1, your final product still has an adequate concentration of preservative. Since it can be considered a preserved suspension, it will inhibit bacterial growth, meaning you can keep it longer. So they've extended the formulation or the beyond use date for suspensions. So long as they are adequately preserved with preservatives, you can put them as long as 35 days. So for me today, for me on the exam, I want you to learn and memorize 35 days. If you're using commercial products and you're using them the way they're supposed to, and they're preserved in the end because of that, then 35 days is the beyond use date to use. We still want you to put it in the refrigerator because that could still slow down the potential growth of any bacteria, but you can keep them now longer, which is a good thing. You can keep them for up to 35 days. Okay, sorry for the confusion. Used to be 14, but that's the deal. If you don't use a commercial product, if you do make it yourself and you don't preserve it, it's only good for 14 days. But we're using commercial products, so 35 days. Okay, let's get past that, Larry. Storage, refrigeration. We do want you to keep it in the refrigeration. Okay, refrigerator. The other new thing, here's a new thing for you guys. You'll notice that the prescription bottles are amber in color, or they're kind of this brownish color, and that's on purpose. They need to be stored in a light resistant container. So the take-home message is storage conditions is refrigerate, light resistant container. You can substitute the words amber bottle or amber container. Amber, the word that describes the color brownish that we use, is naturally light resistant. So either amber container or light resistant container and refrigerate. Okay, those are the two things we're going to be grading for the storage. Okay, so why aren't I going there? All right, drug labeling is pretty straightforward. It's going to be drug name, in this case, botanicol, drug strength, but here's where it gets tricky again. Make sure you're careful with your concentration. So just 7.5 milligrams per 5 mLs. What could possibly go wrong for you on the exam? You would type something like 7.5 milligrams per milliliter. Oh, that wouldn't be right. It's per 5 milliliters. So make sure you're careful in how you describe the concentration. And then lastly, for me, you need to describe it as an oral suspension, like we did with oral capsules. you're making a suspension. So the dosage form is a suspension, but it's an oral suspension since it's intended for oral use. You can make topical suspensions. That's essentially a lotion. You can make suspensions for the ear or otic suspensions. You can make ophthalmic suspensions. So a suspension doesn't tell you where it's intended to be consumed. So we want you to describe it as an oral suspension. All right. Auxiliary stickers, there are 2 of them for this one that we're going to grade for. You need to take a shake well because the patient needs to shake a suspension every time before they use it. So shake well, and a keep in the refrigerator to remind them to keep it refrigerated. So shake well and refrigerate are the 2 auxiliary stickers that we're going to hold you accountable for on the exam. Okay. All right, let's kind of briefly go through your prescription here for your wet lab. We're not going to do the calculations for you, but let's make sure you understand what you're making. So you have a suspension here for Donald Wright, and what he needs is a unique combinations of drugs at a unique strength. That's kind of the advantage. He probably could swallow a pill, but the pill doesn't come this way. So let's make a liquid formulation that has the right drugs at the right concentration for him, okay? So what he needs is allopurinol, a drug used for gout, at a concentration of 180 milligrams per 5 mLs. And we want that combined with hydrochlorothiazide at a concentration of 12.5 milligrams per 5 ml. So the 2 different drugs have 2 different purposes and 2 different concentrations. And yet we want them combined together into the same suspension, okay? And we're going to want to dispense 60 milliliters. All right, look at the additional information. A couple of things. You have to use the exact method, okay? Which means that you're going to prepare exactly 60 milliliters. And that will make it a little more difficult, you'll see, with the amounts that you need for your drug products here in a minute. Why would you do the exact method? I said the excess method was easier, and in some ways it definitely is, but there are definitely times you would not use the excess method. So times that you absolutely need to do the exact method are when the drug is really expensive. You realize some of these medicines, 1 pill, 1 tablet could be $300. I don't want to throw away an extra pill or 2 if it's going to take away any money I could make on that prescription. So when it's an expensive drug, we don't want waste. That would be a waste of my money, right? So expensive drugs, exact method. Controlled substances, even if they're dirt cheap, you can't just throw away and discard a controlled substance. You have to maintain that inventory. So in my example with the botanical, had that been a controlled substance, that extra 20 milliliters, I'd have to put that in a bottle. I'd have to label it. I'd have to send it back to my reverse distributor to be destroyed after I document it. So you can't just discard it down the sink. So controlled substances, do the exact method. Okay, so point being, there are some times that you want to do the exact method. And this is an example where you're going to do the exact method. So keep that in mind as you do your calculations. So speaking of the calculations, I will tell you, turns out your allopurinol comes from tablets and your hydrochlorothiazide comes from capsules. All right, I just won't even beat them around the bush like I did this week. It turns out your allopurinol, when you do the exact method, it doesn't come out to an exact number of tablets, right? It's going to be some fraction, something 0.8 or 0.5 or something, okay? So in the exact method, you're not going to make more, so you're going to have to obtain the right amount of drug. So you're going to have to round up to a number of tablets, do the weights, and remember, since it's a tablet, it weighs the same as a tablet as it does as a crushed powder, so don't crush it yet. Just get the number of tablets, that having rounded up, get the weight, and set up the proportion. The active ingredients in your number of tablets divided by the weight of those tablets equals the active drug that you want divided by X. And you can solve for, therefore, the amount of powder that provides you the amount of allopurinol you need, okay? That's what I'm saying is in the exact method, you have to do that work. It's not as easy as the excess method. Nevertheless, if you've done that before, you can do it. Good news is for the hydrochlorothiazide, it does end up being an exact number of capsules. So you don't have to set up the proportion for the hydrochlorothiazide. What's interesting, though, just to kind of deal with some questions we've had all week, when you open up the hydrochlorothiazide capsules, regardless of how many that you need to open, it turns out you don't need the weight of that powder. Unlike when you made capsules, you needed to know the weight. Even if you were using an exact number of capsules, say 4 capsules, you had to know the weight of those 4 capsules because you had to subtract that weight to determine the lactose. And the reason is capsules are dosed by weight. But your suspension today is not dosed by weight. It's dosed by volume. So as long as we put all of these powders in the right final volume, who cares how much the suspension weighs? I don't know what a teaspoon weighs, but I don't care what a teaspoon weighs. So as long as I put the right amount of drug in the right volume, you don't need to account for the weight of that capsules. Okay, as long as you put the right amount of active ingredient in there, that's what matters. All right. Now, so there are some calculations to do with this. So do those calculations. To do them, you're going to have to get the weights of the allopurinol tablets. So you can't just look at my key. You're going to have to do your calculations and set up your proportion and then come up with your own numbers. But before you do it, check my key. I do have keys posted at each of the supply stations like normal. Check them. Make sure you know what you're doing. But this is where I worry. Some of you go to the keys too quickly and then don't really know what to do. I kind of guided you a little bit too much. So think through this. I recommend you try to do the calculations on your own. They're kind of guided on your sheet, and then check them with the key. And do whatever you want, but that's my recommendation for you. All right. Documentation. To get out of lab today, since it does not take as long, suspensions are easy to make. You're going to see that they don't take very long to make. We are going to check more carefully on your documentation. So you have to have all of your documentation written out, including the ingredients. Judy had tried to make this point earlier for the allopurinol, since you're going to have you're going to have to weigh the powder from crushed tablets for allopurinol. You need 2 lines for allopurinol. One that says allopurinol 300 milligram tablets, and another line that says allopurinol crushed tablet powder. All right, 2 lines. Hydrochlorothiazide, you only need the 1 line for the number of capsules. So just be careful with your documentation. We're looking at that. Definitely write out a full QA and everything else. So I'll remind you, including all of that. Part of checkout today is us going through your entire worksheet to make sure you got everything for the exam. Okay. Beyond that, you're going to make it. So to get out of lab, you got to, make your product and complete all of your documentation. Now we're going to bring it over. We're going to QA it. And we're going to check for floaters. We're going to check for a correct final volume. I will tell you this, check your volume, because even if you measure exactly the right amounts for the ingredients, because some of it stays in the mortar through the rinsing process and everything, you might end up a little bit lower, okay? So I do want to talk about the procedure here a little bit with the exact method. What is different? I want everyone on your sheets do this. It's really important that you kind of circle this part of the step where it says rinse out the drug. Okay, we did not have to do that in the excess method because we just poured the pre-made suspension into the bottle. Here, you're making part of the suspension with the drug. You're going to pour part of it into the bottle, but you're using color. The reason we chose these drugs is they're colored. There's going to be a yellow color. Look, there's still going to be a bunch of yellow left in your mortar. That's drug. Remember, in the exact method, you need all that drug. So you're going to use some of your Aura Sweet in small amounts to rinse and kind of rinse around in the pestle in the mortar and pour that into the bottle. Rinse again, move it around, pour it into the bottle. So it'll take at least 3 or 4 rinsings to try to get all of the yellow that you can out of the mortar and into the bottle. Okay, a key thing for the exact method, because you in the exact method have to transfer all of the drug from the mortar to the bottle. You do that by rinsing. I'm just emphasizing that that's a unique step for the exact method. Okay. Beyond that, I'll just say, remember for the exam, there's an errors and omissions component to it. I know you're not going to spend the time to do it today. I have posted a key for your packet, errors and omissions, online in Blackboard. Take the time, and let's definitely have you guys get 10 points on that next week. All right.